problems, worries, sadness? Are you seeking solutions?
Bible says,
Do not be anxious about anything. Instead, pray about everything. Choose faith over fear.
Welcome to Vital Signs, your prescription for a healthy family, where members of the Catholic Medical Association will explore medical topics vital to the health of you and your family members. I'm Dr. Tom McGovern, the host of Vital Signs, brought to you by Shalom World TV. Today, we explore depression. What is it? How do we recognize it in those near us? And what can be done about it? Chances are you are related to someone with depression. It's about 1/4 billion people worldwide suffer from it, and the numbers are rising. The United States possesses one of the highest rates in the world, and women are 50% more likely than men to suffer from it. Depression increases by age, so that on average, 1 in 6 of your family members over the age of 50 suffer from it. Depression is a biopsychosocial disease caused by a combination of factors in the body, the world around us, and in our minds. It's the world's leading cause of disability, and patients are more likely to have a substance abuse disorder, eating disorder, or diabetes. Patients with depression account for 2/3 of the 800,000 suicides reported worldwide each year. Sadly, less than half of patients with depression get treated, often because of social stigma that prevents people from seeking help. But the good news is that up to 80% of those with depression experience improvement in their symptoms within 4 to 6 weeks of starting treatment. Today's guest is Dr. Francie Broghammer, Chief Psychiatry Resident at the University of California at Irvine. Francie, welcome to Vital Signs.
Thanks so much for having me, Tom. I'm delighted to be here.
So simply, Francie, what is depression?
Depression, I think, is probably best understood as our body responding to a toxic environment. And what that means is when we're in an environment that isn't good for us, we tend to withdraw. And that withdrawal can look like no longer engaging in relationships that are important to us, maybe feeling less inclined to do things that we previously enjoyed, like exercising, going on walks with family, or even reading books. You might find that it's harder to sleep or harder to even muster an appetite to get out into the kitchen and make yourself some lunch. By and large, the moral of the story is when you're depressed, it's not only just a state of feeling low, but you tend to just withdraw altogether from the activities of daily living.
How hard is it to discern in yourself that you might be depressed?
That's a very good question. And the way I like to describe this to my patients is that we expect to have natural ebbs and flows in our emotions throughout time. To experience anxiety during a day is normal. To feel low sometimes, especially after something bad happened, is normal. But when you experience one emotion, either too loudly or for too long, or maybe both, that's a sign that things might be a little bit out of whack. And again, if the volume's up too high or it's on for too long, and it's preventing you from doing the things that make you you and that allow you to engage in the world around you, that's when you can start to tell the difference.
So what are the most common causes of this toxic environment that can lead to depression?
It's not a simple solution. There's not really a simple answer to that because it could be a number of things. What comes to top of mind as you say this now, the pandemic, political unrest, right? Constantly being fed information from the news and our media that tells us the world is a scary and dangerous place. Those can certainly be triggers. Other triggers might be the loss of a loved one, or something even that could be objectively seen as good, such as the birth of a child, because it brings with it a major shift in your life, right? It could be other normal life events like falling ill, a loved one falling ill, or even losing a job once again, maybe getting promoted, even though that's a good thing. We're talking about a shift in life. And so really, any major life event could contribute. But I also want to let you know that sometimes there doesn't have to be a cause. It's what we call idiopathic, meaning it just kind of happens. And That we know that sometimes comes out of the blue too. And there's no shame. There's nothing wrong with that. Sometimes there's not always a clear reason for depression to evolve.
So that was going to be part of my next question. So what's the relationship between feelings or emotions and depression? Which comes first, the bad feelings or the depression that causes bad feelings?
It varies from person to person, but this is a really important distinction to make. Kind of like I mentioned just a moment before, we're expected to have these natural ebbs and flows in our emotions, right? And if you find that you're feeling low for a prolonged period of time, that could definitely lead to a state of depression where it's harder to engage. But oftentimes, when I work with patients who are depressed, it's not this incredible feeling of sadness that they describe, it's a numbness, right? And so what can start out as feeling low or down over time can turn into feeling nothing, which for many is even more disconcerting because that's a very strange place to be. We're used to having these ebbs and flows in our emotion.
So sadness and depression are not necessarily on the same continuum. They can be different things.
They absolutely can be.
So if I'm depressed, does it mean I'm weak?
Good question. And the answer to that is absolutely not. What we know is that the way we conceptualize our mind, if you will, is very different from the way we think about anything else in our body. For example, say you go to the playground and you fall off a jungle gym and you break your arm. You have to go see a doctor and get a cast, and that's okay. You can visibly see the broken bone. And so there's not really a lot of shame involved in that. People don't think, oh, if I just willed it to be, I could heal this bone without needing a cast or medication. The need is very clear right in front of us. But because our mind isn't as clearly seen as something like a bone or a liver or a kidney, we for some reason tend to think we can will this to be better. But I think it's really important that we recognize our mind is just like any other organ in our body. And part of living means that our organs get sick from time to time. So just like your liver, your kidney, or your bones can get sick, so too can your brain.
Very good. Now, because people view the mind different from other organs, there is a certain stigma surrounding this, that people think there's something wrong with them, that people are going to look at them differently. How can we reduce that sense of stigma that people feel around depression?
Very good question. This is something that's been top of mind as of late, as we're seeing rising rates of depression in America in particular, because we know that more and more people are experiencing this, but we're not necessarily talking about it more. So the number one thing that we can do is actually be open and honest about our own experiences. For example, say you or a loved one has gone through a state of depression. When you're interacting with someone who either shares that they're feeling that way, or you just kind of can tell something's off, a helpful lead into that could be, I remember back after my first child was born, there was a period where I felt really low and disengaged from the world. You could even say I was pretty depressed at that time. I had to reach out and get help. It was really tough. And, sometimes it seems like you could be going through something similar. I've heard you say some similar things to what I experienced during that point. What's that been like for you? So not only this act of normalizing and having shared experiences, but also opening up the ground to say, what's your experience been? And then when someone else is willing to share, the most important thing you can do is zip your lips and listen, because actually being there to meet them with the experience that they're having is one of the most therapeutic things that you can do for that individual. And also one of the most important things we can do to decrease stigma and just meet people where they're at.
That is great practical advice, Francie. Something that religious people sometimes wonder is whether or not it's a sin to be depressed, or if sin can be cause of depression.
That's a very interesting point you bring up. And I want to break that down in a couple different ways, if that's okay with you, Tom. So the first way, is it a sin to be depressed? Absolutely not, because the human experience means that we have this natural change in our emotions, right? Jesus, many saints throughout history have battled with things such as depression, anxiety, even addiction, right? This is part of being alive and being human, is experiencing these emotions. And there's absolutely no shame in that. The second piece of what you brought up here is, does being depressed make it more likely that you could fall to sin? And the answer to this, interestingly, is yes. Because what we know from the positive psychology research is that when you're in a more negative emotional state, you're more likely to turn to what we call maladaptive forms of coping, meaning you're not feeling very good. So you might say, I feel a little bit better after I have a glass or 2 or 3 or 4 of wine, right? Or maybe after I just take one more hit of the cocaine in front of me, for example. Or maybe life is too stressful. I'm feeling really down. My neighbor across the street might be able to offer me some consolation that I'm not able to find at home, right? These are solutions that we tend to turn to when we're in a more negative state, emotionally, I mean. And so it's not necessarily that being depressed is a sin, but we know that when you're in a more negative emotional state, you're more likely to act in ways that are sinful because you're just looking for some reprieve.
That makes sense, Francie. And going along with the religious line of questioning, is there a relationship between religious practice and depression?
Absolutely. I'm so glad you asked this. So there's a couple really interesting relationships here. First of all, I want to say that individuals who have a strong faith life are not immune from becoming depressed. So I don't want that to be a takeaway here at all, right? Being depressed, having these ebbs and flows in our emotion, again, is a normal part of the human experience. That is how God created us. Okay. That being said, we know that being part of a robust faith community can be protective against depression and more so even against suicide, actually, because we know that part of the lived experience of depression is this loss of hope. And hope, as I think we'll be able to talk about a little bit more here, is one of the most important protective factors when it comes to suicide.
So another thing I know that you're interested in your research is the relationship between loneliness and depression.
Yes, I'm glad you brought that up. So what's interesting, and I'm going to back it up even a little bit farther, Tom. So I do some research on what's called deaths of despair, deaths due to suicide, drug overdose, and alcohol-related illnesses. And when I started doing this research, we were finding that people were dying of all different causes, in all different age groups and demographics, racial and ethnic backgrounds, etc. So why on earth are we seeing a rise in all these deaths when they seem a little bit random, right? What ties all these deaths together? And trace it all back far enough, what we found is that the single most unifying factor amongst all of these deaths is actually loneliness, a sense of isolation from people and the world around you. Whether you're a 13-year-old girl that's getting bullied at school or a 50-year-old man who's recently been fired and having a hard time providing for your family, and whether you're turning to suicide or drugs of abuse, we know that upstream, most people in these situations do experience a state of loneliness. And it's actually so profound now that 1 in 5 Americans say that they have no one they can talk to when they're going through a difficult time, which to me is just heartbreaking.
And along that idea of deaths of despair, what is the relationship between depression and suicide?
Okay, good question. So suicide, the act of taking one's life, is often preceded by a state of depression, right? And you can be depressed in like the very clinical sense as a major depressive disorder. You can be depressed as a result of other psychiatric illnesses such as schizophrenia or bipolar, or you could be in a more acute state of depression in response to a stressor, such as losing your job and not seeing a way out. So any of those things could be at play downstream, but what really takes you from one to the act of suicide, right? That's the question. And the answer that leads you from one to the other is actually hopelessness, right? A belief that you're in a really bad spot, things are not going to get better. There's no reason to continue fighting. Therefore, taking your own life might be the only way out, the only light that you can see at the end of the tunnel.
And if somebody is this hopeless in a family and mentions they've thought about suicide, what should you do if you witness a family member telling you that?
Absolutely. Pull up a chair and sit down is my number one piece of advice, because this is, first of all, a very privileged position to be in when someone's willing to share that information with you. And it's not something that they share easily. And so I think that's an opportunity to really carve out some time, no matter what your day is looking like, and say, can you tell me a little bit more about that? What has this been like? Because one of the most profound things about being in a state of depression, considering suicide, is feeling like you don't have anyone around you, this state of loneliness. So really working to build that community. And when someone shares information that can be a little scary, right? If someone says to you, hey, I'm thinking about ending my life, your first instinct might be to run. I don't want to talk about this. This is hard. But to actually sit down and to be present with them is the most important thing you can do in that moment. And then from there, it's about getting connected to safety and resources, right? 911 is always going to be the simplest, easiest kind of resource to give because it applies everywhere all over the country. But there's local resources within each community, et cetera, that we can chat about a little more too, if you'd like.
So what if a viewer has a family member not quite as bad as thinking about suicide, but they think they're depressed? What should that family member do next? Especially
Good.
if it's a parent with a child.
Right, right. So good question. And the answer is by and large the same, because at any point in time, the ministry of presence is protective and healing here, right? And ideally, we'd love for someone to share this information with us earlier rather than later. So I'd much rather someone come to me and say, I'm feeling depressed and down, than come to me and say I'm suicidal, right? So if they're sharing this with you, I don't quite feel like myself. I'm feeling more withdrawn. It's, first of all, things that are not helpful is also something that's important to say here. Things that are not helpful. Well, we don't have it as bad as Vicky next door who recently lost her mom, right?
Yes.
Remember, it could be worse if. Those statements are typically never helpful. And so again, your most helpful intervention here is going to be seeking to understand and giving the gift of time and your presence.
So after you do this, how do you decide as a parent or a spouse, or even if it's yourself, whether to seek a professional or to use various self-help strategies?
Good question. So this circles back to what we talked about pretty early on, which is the level of impairment in daily functioning, which is a very fancy way of saying, can you not do the things that you need to do? Right? Is it hard to get to the grocery store? Is it hard to get out of bed? Are your kids skipping meals because you're not up to make breakfast and you can't engage in those ways? Has it been 3 days since you showered? Right? Did you used to love spending time with your sister, but you're not even calling her anymore? So all of these little actions that make us whole during the day and that allow our lives to function, if those are stopping around us, that's really the red flag to say, I need to go talk to someone and really reach out and engage with those resources. If you're just starting to feel a little bit different before that, like a little bit off, not quite as engaged, maybe this is where some of the self-help books could be more helpful.
And what if somebody is just feeling a little down, but they want to prevent getting lower? What are some general things to do? Like I've heard exercise can be amazing.
That's my favorite. Yes. So 3 to 5 days a week, 20 to 30 minutes of cardiovascular exercise. So getting out, running, jogging, walking, biking, if stationary bikes are really popular right now in homes, anything like that is just as effective for mild to moderate depression as our leading medications, which I think is amazing,
Wow.
right?
It is.
So whenever I meet with patients, I always propose this. Mental health is like a puzzle, right? And there's all of these different puzzle pieces. Seeing a therapist and medications are potentially one or two of those puzzle pieces. But at best, if medications and therapy are doing their job, they're going to boost you to a point where we can really start to focus on all of those other puzzle pieces that have to come into play to make your mental health picture whole. This is where we're talking exercise, engaging in relationships. Relationships are incredibly protective, right? Nutrition. Are we out and are we binging on fast food burgers where we know we're going to crash and feel worse after? Or are we having, a couple fruits and vegetables with dinner, things like that? So really engaging in the lifestyle modifications that lead to more meaningful, long-term, healthy, happy, flourishing lives, even in the absence of medications down the line.
So we've talked about hopelessness, but let's talk about hope. Hope is really anticipated joy. What hope can we give to our viewers, even those with more severe depressions or whose loved ones have more severe depression?
So I think it's very, very important that whether you're suffering from depression, someone you know might be, or someone that you know in the future might be, just to prepare the message that depression gets better, right? When you're in the throes of this, when you're in this deep, dark cave and it feels like no one's around you, it feels like this can go on forever and there's no reprieve in sight. But I have treated thousands and thousands and thousands of patients who have felt this way. And guess what? They get better. It takes time and you have to walk with people on that path. And it's not just you and your doctor, it's their family, it's their friends, it's the community around them, the religious congregations, right? But with time, sometimes it takes more than a day, a week, or a month. We're talking several months sometimes, right? But it will get better and you can go back to that state of feeling like yourself, waking up in the morning, being excited about the day and enjoying making breakfast and hanging out with your kids. You can get back there. It just takes a little bit of time. So let that be the light at the end of the tunnel, is that it does get better.
Final question. What are the best resources you can recommend for people dealing with depression in themselves or in their family members?
Oh, there's so many. So a couple I would recommend. NAMI is a National Alliance for Mental Illness, and it's nationwide. They have different resources in each community, so it's a great place to start. You can see if there's any support groups or other meetings that are happening local in your area. And this is both for patients and family members. So that's a very helpful resource for people wherever they are in the country. If you're seeking someone in particular, psychologytoday.com is kind of like a Yelp for therapists and psychiatrists. So you can see who's in your area, what type of insurance they take, and help get you connected to resources that way. But in addition to that, I want to highlight a couple other things. The lives of the saints can be really, really important here, especially in our healing journey and normalizing what it can be like to be in a state of despair. And actually, our mutual friend, Dr. Aaron Cariati, has written a book, The Catholic's Guide to Depression. And I would definitely put this on the list of resources here for those who are contending with any type of a mental struggle in this way.
Francie, thank you so much for being with us on Vital Signs.
Thank you, Tom. It's been a pleasure.
And thank you, viewers, for watching this episode of Vital Signs, your prescription for a healthy family, brought to you by the Catholic Medical Association and Shalom World TV. Please join us for our next episode and share the good news of Vital Signs with a friend, and may God bless you. I encourage everyone to send us emails with questions that you want to ask medical experts. Please email us at vitalsigns@shalomworld.org. Your questions and comments will help us determine what topics we'll cover in the next season of Vital Signs.
To all of the viewers of Shalom TV throughout the world, I want to encourage you not only to support this amazing media apostolate, but to spread the word to others. We all know how the internet and mass media are polluting the world with the poison of pornography and so much other forms of materialism. This is the source of eternal life, the gospel, and Shalom TV is consecrated to spreading the word of Christ. Thank you.